Welcome back to this segment of Healthcare Consumerism Radio. This is Brent Macy and Doug Field coming to you from the studios in Sandy Springs, Georgia. And we'd actually like to welcome Mike Meyerring from Businessolver onto the program. Mike, how are you doing?
Good. Good morning, Brent, Doug.
Good morning.
Hope you're doing well. Kind of give our audience an overview of Businessolver. You guys have been around for a long time. Kind of give them a feel for who you guys are.
Yeah, absolutely. So Businessolver is a benefit administration organization that's been around for 16 years, and we've really focused on trying to continue to provide employers tools to engage their employees as it relates to their benefits program. So we've had a lot of experience in serving the marketplace model for a number of years, 14 to be exact. So really excited to have an opportunity to talk today about private exchanges.
Yeah, tell us about that, Mike. When did you roll out your private exchange?
Yeah, so as a private exchange, in my mind at least, if we define the private exchange, really the simplest way to do this is to say employers are trying to control their expenses, and they're trying to offer a lot of choices to their employees to help them choose the right benefit plan for their lifestyle. So as a benefit administration organization, we've been supporting benefit trusts, benefit associations, these marketplace models for a number of years. So when we talk about our technology supporting this model, really it comes down to, from the employee experience, we offer them decision support, whether that's through our decision support tools online or live service center support so they can speak to someone. We have the ability to drive education through hard copies being sent out, and really that's solving for the generational gaps of those communication needs. And then when we think about the employers from a private exchange, we're offering them integrated tools so they can continue to drive strategy, stay in touch with their employees, connect with them, offer defined contribution, which is totally not a new concept. Do the reporting, get integrated with their payroll, and offer them some consolidated billing. So a couple of aspects that we support there.
It's interesting. At IHC Forum West in December, I led a share session on defined contribution private exchanges that was very interactive. But towards the end, it got a little heated, not in a bad way, in a very positive way. But somebody raised their hand and says, "What is an exchange?" Another person raised their hand and says, "It's simply benefit admin on steroids right now at this stage in the marketplace." Would you kind of agree with that to a point?
Yeah, I think to an extent. I think that there's a lot of confusion out in the industry today about what a private exchange is. Yeah. But, really, if you look at the industry as a whole, medical insurance premiums continue to increase, and so it's becoming an issue for employers to continue to leverage benefits and offer them as a talent retention tool to their employees. So, a private exchange, the simplest term, is how can the employer control costs and still attract the best talented employees? And so there's a myriad of different ways that we believe you can slice and dice this thing. And, I don't necessarily think a private exchange is too different than an employer offering multiple plan choices to their employees and changing the way they fund it.
Yeah. And Mike, if you look out at the marketplace, you got a lot of employers. I think there's a lot of studies that we've seen anywhere from 40% of employers are going to look at a private exchange to 90% of employers. So we kind of look at it and let's fall in the middle somewhere. That means a good amount of employers are going to look at this option. Doesn't necessarily mean that they're going to go this direction. But from a sustainability standpoint, do you see a private exchange sustaining itself moving forward in this marketplace?
I think you're going to see some winners and you're going to see some losers. And I think that some of the private exchanges that will be sustainable will come down to what is the overall strategy of the exchange. So does that exchange have the ability to engage employees and drive population health management? The exchanges that are developing strategies around that, those will be the ones that will be sustainable. I think the exchanges that are simply throwing products at employees, even if they have decision support tool, I think those will be the losers. In fact, there's a great article by the Employee Benefit Research Institute a while back that talked about offering multiple, when you look at pension to 401k, offering multiple product options to employees. It was paralysis by analysis. So those exchanges that are just simply throwing a lot of products at employees that they've never dealt with or never been faced with having to choose and make a informed decision, I think that's just going to be the exchanges that won't be sustainable.
So Mike, how does an employer know which model is right for them?
That's a great question. I think the most important thing is the employer has to understand how have you been leveraging your benefits to this point, and how do you want to leverage your benefits moving forward? And then you need to find the exchange that's going to match that strategy. So and there's going to be a lot of exchange options out there. But when you sit down with your benefit broker or consultant, you need to ask them or give them your short list of, I'm looking for an exchange that can help us continue to drive employee engagement or continue to drive our wellness program or population health management. And then you have to actively go out and find an exchange that aligns with your strategy. Because what we're seeing with our population is even if an employer is considering moving to a private exchange, they don't want to lose that connection with their employees. It's still an extremely important aspect to their total compensation. Guardian came out with a report recently, 71% of all employees still feel that their benefit offering is extremely important. So this is still a major tool that employers are using to really separate themselves from each other, which is attract talent.
Yeah, because if a private exchange is done the right way, it does provide, to your point, that complete health care and health management experience, health care benefits and health care management experience, including some of the transparency tools. It actually can improve that connection, correct, with employees?
Absolutely. And I think that what will be important there is that the connection is made available through different communication styles. As we look at the generational gaps that exist today, every generation may want to receive their information differently. And by that I mean they may want to have education where they go online and they research it themselves. But not all employees are going to be that way. Some folks may want to call and talk to someone live and have a counselor that can help them. Or, perhaps they just want to have the information pushed to them. Send me the benefit booklet through the mail. Let me read through it and review it myself, and then I can call someone and get help on the enrollment. But you have to be able to deploy those methodologies, in our opinion, so that you can really stay connected with all of the different flavors or styles of communication preferences.
Mike, you had mentioned earlier in the segment that the exchanges that are going to win are going to be the ones that really look at the total population health piece. Where is that connection in the exchange? Is it something that Businessolver goes out and says, hey, I'm going to go partner with and it's just an example, a Healthways, a Red Brick Health, or someone who's in the total population health management business specifically, and I'm going to embed them into my exchange? Or is it something that's going to be sitting outside of the exchange that you're going to need to educate the employer on to make sure that your exchange platform is successful for them married to this health management program?
That's a great question. The way that I would describe it is we have roles at Businessolver that are responsible for strategic initiatives with our clients. And so we would expect that they would get involved with the employers, with the brokers, and develop and identify who that particular strategic partner is going to be for population health management. And then, it is a bit of an educational standpoint where we can help that employer understand where are the connections, how can they lever the different tools, and how can we all play together so that it's going to drive the overall population in a particular direction. So, in our opinion, the best way to do that is you have to be able to integrate with different carriers, with different providers, because your medical insurance carrier is going to have some unique tools that they can bring to the table that you need to be able to get those employees over there. Your population health management provider may have some unique tools, so we need to help to be able to drive those employees to all the different tools and features that be available to them.
That's good points, Mike. Mike, before the segment's up, you make a good point about a piece that is not a small piece that I think needs to be addressed, and that's the subject of identity theft and what exchanges do to protect, and what are you guys doing specifically to protect, the consumer?
Yeah, and I'm glad that you bring that question up. With the exchanges, we see a number of technology providers that are coming to the table, and so employers will have many more choices of where they want to put their employees' data. And if we look at the target data breach and the revenues having a significant hit as an outcome of that, there's real risk of choosing an exchange that has a technology backbone that isn't doing the proper audits to make sure that their security is where it needs to be. And so one of the things that we've done at Businessolver is we invest, and it's not cheap, but we invest a large portion into third-party audits to have independent people come in, do the SSAE 16, do the network penetration testing, because at the end of the day, you have real employees with real dependents sitting on a system, and the last thing that you want to do is have it be hacked. The public exchanges, read an article yesterday, public exchanges are going to be a hotbed for hackers, and there's a lot of concern because there's not security being done. So as employers are looking for exchanges, they need to know what questions to ask, and the brokers and consultants certainly need to make sure they're going through and checking to ensure that the security providers are going through the necessary audits, because nobody wants to be in target's position.
Right. Mike, we got about a minute left on this program. Kind of give our audience the one point on where you see the exchange market moving, and then let them know how they can find you guys if they have any more questions about kind of your products and solutions.
Yeah. So I think the private exchange model 10 years from now, let's just say, you're going to see those exchanges start operating as pooled insurance groups. They're going to be running some self-funded models, but the ones that will still be around are going to be the ones that help employers engage their employees, become productive employees, and really offer the most support across all of the different generational gaps. And to find out more about how we're supporting private exchanges and what our experience is, they can go to Businessolver.com, and we'll have a bunch of information out there and some numbers that they can contact us.
Hey, Mike, thanks so much for joining us on the program today. Have a great weekend. And our audience, Businessolver will be exhibiting at IHC Forum and Expo here in Atlanta in May, so you will be able to go by, see their booth, understand their solutions, and we encourage you to do that. Mike, again, thank you so much. And to the rest of our audience, please stay tuned for the next segment of Healthcare Consumerism Radio. Welcome back to the final segment of Healthcare Consumerism Radio. This is Brent Macy, Managing Director of the Institute, along with Ron Bachman. And joining us on this segment, we're going to talk about private healthcare exchanges. And joining us is Jim Freeze. He's the Director of Sales for ConnectedHeal. Welcome, Jim.
Thanks, Brent. I appreciate the opportunity to speak with you today.
Yeah. Now you're in the fast-moving, ever-changing world of private healthcare exchanges. Kind of look into your crystal ball and kind of give us an idea of what you guys are doing there at Connected Health and kind of where you see the private healthcare exchange market.
Well, I appreciate it. Yeah, as you can imagine, the media has definitely provided an increase in our exposure, and we're enjoying it. With the recent healthcare reform changes, Connected Health is a consumer marketing organization that helps employers grow their business by ensuring that their employers are healthy and financially secure, using the defined contribution strategy and organized marketplace, either on a group-based platform or using individual policy platform. And as the guaranteed issue came into play on January 1st of this year, we see the marketplace really exploding for those employers, not to get out of healthcare, but really kind of change the direction of how they offer healthcare to their employees, and for the first time really be able to provide that in a very cost-effective, easy-to-budget manner.
Now, when you kind of look out at the marketplace, you've obviously got healthcare.gov, which is the federal side of it. Are you running into any confusion between the federal piece and the private exchange piece when you're talking to employers? And if so, or if not, where does the private side help employers better than what the federal side would?
Perfect. Yeah, and I think the biggest difference that you'll see in the private exchange with ConnectedHeal and other private exchange organizations is it's really being directed more through the employer marketplace or the workplace, and that helps educate and coordinate the process of the messaging much easier. Obviously there is some confusion, and there's some very, very valid frustration in the process that's been in place both in the public sector as well as some of the private exchange marketplaces, because it's a new avenue and a new process to deliver how healthcare is offered to the market. So, I think the biggest challenge that we have is how we message and how we educate the marketplace and make the user experience the key essence of what we're trying to deliver. Make it easy to administer, easy to understand, and provide the right tools to make the right decisions going forward when you're making a very significant financial decision process.
Jim's Ron Bachman here. I looked at your website, and it's got some great points there about what I call health literacy, helping people to really understand. And there's 4 points that I picked up off that website that you're trying to differentiate yourself, and that's to be sure people understand their options, decode the industry jargon, to personalize their benefits, and then to build confidence in their financial choices. Tell me about what you're doing different in that area to be sure that that individual employee really understands what they're doing and can sort of weave their way through this very complicated area of health care and health insurance.
Perfect. Thanks, Ron. I appreciate that. And really what Connected Health is trying to do is develop a health financial score, and health financial, it really engage the employer so that it's not just a quick quoting process. We want that individual to be engaged in looking at the right plan that fits their financial needs, their demographics of their family, making sure that they've got the right coverage levels, but being able to do that so that when they're in the process of selecting the plan, they're looking at not only the cost of the premium, which is going to be a major decision factor, but what are some of their expected out-of-pocket costs, and what is the maximum cost that they'd be looking at? So they really have a better picture of their total exposure. And then when they're in there and looking at the different plan options, we also want to be able to coordinate so that they have a sound understanding of their overall protection. If they select a high deductible health plan, are they also making sure that they're provided to have the health savings account, if it's a health savings accountable plan? Mm-hmm. And are they looking at making sure that they've got the right coverage levels in regards to their family demographics through life insurance and disability coverage and other features, and really look at a full financial score and aspect of their coverage level. We don't also want to, because now with the open marketplace and the individual markets is seen, you could have 120 different plan choices that are available to you in your region. We want to be able to kind of narrow that funnel down and allow the individual to mitigate the plan choices based on what they're looking at in different parameters. So if I want to see certain plans that are under, a certain premium level, I can adjust the choices and allow only to see plans based on those parameters. And that makes that process a very easy to follow, very intuitive process, and it allows that employee to make the right choices based on their demographics.
Now, Jim, I know you guys work with some broker groups. I'm not sure if the broker group that was going to join you was able to make it, but I know there's that connection point. And why do broker organizations or general agencies, why do they choose to partner with Connected Health? What's the reason for that?
I think they see that the marketplace is taking a significant change, and the employers are asking for better opportunities to manage healthcare costs. This is an innovative approach to, asking, do you want to look at defined contribution strategies? And if you do, how do you make the tools available for your employees to make that educated decision as they're going to be provided more choice than they've ever been? And I think the opportunity to be flexible and scalable in our services, allowing them to be able to integrate and provide additional values other than just the healthcare, rounding out other benefit programs and health outcomes opportunities as well. We really see the defined contribution in the health outcomes area growing dramatically now because the employer and the employee is engaged. And again, they're taking the responsibility now because they're selecting the plan that fits them, and there may be more costs associated with them in regards to higher deductible health plans and other features. So they're taking a much more active role, and being able to provide them the right tools, I think, is a significant factor for most brokers as they're engaging their client base going forward.
Jim, you've mentioned defined contribution plans several times, and most people in this space now, that seems to be a buzzword for the industry almost. For our listeners out there, can you explain to them what a defined contribution plan really is, and if there's differences between how it's being used by different solution providers and how you might differ from others when you're using that term?
Sure. And I think 2013 was a monumental year for healthcare with the Affordable Care Act and the ability now to change how healthcare has been delivered. We've not really seen a significant change in the employee benefits market since the early 40s. And typically, healthcare has been offered on a defined benefit strategy where the employer is setting, sharing in a little bit of a cost with the employee and setting the plan choices that are available, sometimes very limited. Mm-hmm. Very similar to what you saw in the retirement side, where the pension plans were the predominant retirement structure up until 401k opportunities came into the marketplace. We see that same very similar option happening in healthcare, where now the employer is saying, I want to be able to control my costs, but I want to, instead of being the one that decides the plan choices and the opportunities for my employees, I want to provide them more choice, and then I'm going to give them a set amount to be able to allow them to go out and purchase the health care options that fit their needs more appropriately. So we're seeing a very similar evolution that we saw in the retirement structure from a defined benefit pension plan into the 401k marketplace. And that's happening in the health care plan as well. The employer is given a set amount of money for a defined contribution, but that employee is able to then go out and purchase the health care or the benefit choices as appropriate.
Now, Jim, we got about a minute left on the program, and want to be able to kind of let you give a couple takeaways for our audience to leave them with. And I know from our standpoint, we've always looked at private health care exchanges. That is ultimate health care consumerism on steroids. And kind of if you look at, where your business is going to move, what are some of the things that our audience needs to be well aware of if they're analyzing moving to a private health care exchange?
Yeah, I think the biggest thing, too, is that, we're really kind of moving away from, that connotation of private exchange because, we really look at it as a more organized marketplace. Being able to centralize the opportunities and administratively make it very easy for the employer to offer a broad array of choices for their employees, making it easy for them and building that retention and attraction of key employees is a key aspect for most employers. So we think it's changing the delivery of how healthcare and benefits are being offered by an employer and giving them significant tools as needed.
Well, Jim, thank you so much for joining us on the program today. Have a great weekend. And to the rest of our audience, today is the final day to sign up for IHC Forum at the discounted rates. So make sure you do that today for the conference here in Atlanta in May. And until next week, this is Brent Macy and Ron Bachman signing off.